Good evening, ladies and gentlemen. My name is Cheryl Crafts, and I'm here to talk about the benefits of immunization to prevent cervical cancer that's related to HPV infection. Most cervical cancers are caused by a sexually transmitted disease known as the human papillomavirus, HPV. However, widespread HPV immunization could reduce the impact of cervical cancer worldwide. Based on all the information we have today, the Centers for Disease Control and Prevention, the CDC, recommends HPV vaccination for the prevention of most types of cervical cancer. Two vaccines are available to prevent the types of HPV that cause most cervical cancers. These vaccines are called Cerverax and Gardasil. Gardasil also prevents genital warts as well as anal, vulvar, and vaginal cancers. Both of these vaccines are given in 3 injections over a period of 6 months. Both vaccines have been approved for use in the United States by the Food and Drug Administration, the FDA. Why is HPV immunization important? Genital HPV is a common virus that is passed from person to person through direct skin-to-skin contact during sexual activity. Most sexually active people will get HPV at some time in their lives, and most will never know it. HPV infection is most common in people in their late teens or early 20s. There are around 40 different types of HPV that can infect the genital areas of both men and women. Most HPV types cause no symptoms and they go away on their own. Some types can cause cervical cancer in women and other less common cancers such as cancers of the penis, anus, vagina, and the vulva, which is the area around the opening of the vagina, and the oropharynx, which is including the back of the throat, including the base of the tongue, and the tonsils. Other types of HPV can cause warts in the genital areas of men and women. Genital warts are not life-threatening, but they can cause emotional stress, and their treatment can be very uncomfortable. Every year, about 12,000 women are diagnosed with cervical cancer, and 4,000 women die from cervical cancer in the United States. About 1% of sexually active adults in the United States also have visible genital warts at any point in time. Who should receive HPV vaccines? The CDC, the Center for Disease Control and Prevention, recommends vaccination with either vaccine for 11 to 12-year-old girls and girls and women ages 13 to 26 who have not been vaccinated or who have not completed the vaccine series. It may be given to girls also as young as 9. It's important for girls to receive the vaccine before they become sexually active and are exposed to HPV. Females who are sexually active may also benefit from the vaccine. They may get less benefit from it because they've already may have contracted one or more HPV types, but some types would still be prevented. The vaccines are not recommended for pregnant women. Although studies have shown that HPV vaccines have not caused problems for babies born to women who received the HPV vaccine when pregnant, they believe that more research is still needed. The vaccine is also safe and effective for males ages 9 to 26 years of age. It is licensed by the FDA for prevention of anal cancer and genital warts. The CDC does not routinely recommend the vaccine for males, but the vaccine Gardasil may reduce their likelihood of acquiring genital warts, thereby preventing the spread of genital warts to their partners. How long does the vaccine protection last? Research suggests that vaccine protection is long-lasting. Current studies with up to 6 years of follow-up data indicate that the vaccines are effective with no evidence of decreasing immunity. Both vaccines are highly effective in preventing specific HPV types and the most common health problems from HPV. The vaccines do not protect against all HPV types, so they will not prevent all cases of cervical cancer. However, about 30% of cervical cancers will be prevented. So it will be important for women to continue to get screened for cervical cancer by continuing to have their regular Pap test done each year. The vaccines do not prevent other sexually transmitted diseases, or STDs. Study of the HPV vaccine is a common concern, or the safety. Both vaccines have been licensed by the FDA for females ages 9 to 26 and approved by the CDC as safe and effective. Both vaccines were studied in thousands of people around the world, and vaccine safety continues to be monitored by the CDC and the FDA. These studies showed no serious safety concerns. Common mild adverse effects reported during these studies included pain at the injection site, fever, dizziness, and nausea. More than 35 million doses of HPV vaccine have been distributed in the United States as of June 2011. Serious side effects include severe allergic reactions such as anaphylaxis, some neurological conditions such as paralysis, weakness, and brain swelling have been reported in a very small number of women. The FDA continues to monitor all such reports. However, to date, almost all reports of these reactions appear to have occurred by chance around the time of the immunization, and they don't appear to have been caused by the vaccine itself. The cervical cancer vaccine is currently part of the routine childhood vaccine schedule. Whether or not a vaccine becomes a school enrollment requirement is decided on a state-by-state basis. In conclusion, there has been much controversy surrounding the cervical cancer HPV vaccines. I have heard that many mothers of young girls are still not sure if they want their child to receive this vaccine. As with all vaccines, there are side effects, and it is difficult to decide what is best for our children. I feel that the long-term effects are the benefit that we should be looking at when determining what is best. HPV and cervical cancer is an ongoing health issue, and I think that it can be prevented, that parents should seriously consider the benefits of the vaccine. If it can be prevented, they should really look at the benefits, okay? Protecting our daughters and their daughters from the HPV virus and the risk of getting cervical cancer is definitely at the top of my list. Having some personal experience with these infections in my own family has made me a believer in protecting our loved ones from this disease. I hope that all of you will take the time to explore the values and the benefits of immunization against HPV. Any type of prevention for any type of cancer sounds like a step in the right direction to me, and I hope it will to you too. For more information on the safety and benefits of the cervical cancer vaccines, please visit the online sites for the Centers for Disease Control and Prevention, the Food and Drug Administration, the American Cancer Society, and the National Cancer Institute. And thank you all for listening. Have a good night.